In the narrow row houses of Baltimore's Federal Hill neighborhood, where the smell of crab cakes from the harbor mixed with the coal smoke from countless chimneys, a baby named Harriet Morrison would become trapped in one of medicine's most heartbreaking prisons. Born in 1891, during the height of America's Gilded Age, Harriet developed normally for her first 11 months, reaching for toys, babbling her first words, pulling herself up to stand with the determination of any healthy infant. Then, as if someone had thrown a switch in her developing body, her growth simply stopped. Her bones ceased lengthening, her muscles stopped strengthening, her voice remained locked in the high pitch of infancy, while her mind continued to develop and mature within the confines of a body frozen at 11 months old. For 32 years, Harriet would live as perhaps the most tragic paradox in medical history, a fully conscious, intelligent adult woman trapped in the body of a baby, aware of everything happening around her, but unable to communicate her thoughts, dreams, and desires except through the limited vocalizations and gestures of an infant. Her case would challenge everything physicians understood about human development and force her family to confront the unthinkable reality of caring for a child who would never grow up, never walk, never speak clearly, but who would experience every emotion and intellectual awakening of normal human development while remaining forever helpless and dependent. The Baltimore of 1891 was a city in the midst of dramatic transformation, its skyline dominated by the smokestacks of steel mills and canneries that processed the bounty of the Chesapeake Bay. The city had emerged from the Civil War as one of America's most important industrial centers, its strategic location between North and South, making it a crucial hub for trade and manufacturing. The Harbor District, where the Morrison family lived, was a bustling maze of warehouses, shipyards, and immigrant neighborhoods where families from Ireland, Germany, and Eastern Europe had settled to work in the city's growing industries. The air was thick with the smell of coal smoke, steaming seafood, and the salt breeze from the bay, while the sounds of ship whistles, factory bells, and the constant clatter of horse-drawn wagons filled the streets from dawn to dusk. Federal Hill, rising above the harbor like a green island in the urban landscape, provided a vantage point from which residents could survey the entire city spread out below them. The neighborhood was home to working-class families who had achieved a modest prosperity through steady employment in Baltimore's thriving economy, though they remained just one economic downturn away from the poverty that plagued much of the city's immigrant population. The row houses that lined the narrow streets were typical of Baltimore's architectural style, three-story brick buildings with white marble steps that residents scrubbed religiously each morning, narrow facades that belied surprisingly deep interiors, and small backyards where families grew vegetables and kept chickens to supplement their income. Thomas Morrison worked as a foreman at the Bethlehem Steel Shipyard in Sparrows Point, where he supervised teams of workers who built the vessels that carried American goods around the world. He was a skilled craftsman who had learned his trade through years of apprenticeship, and his position as foreman provided the family with a comfortable middle-class income that allowed them to rent a well-maintained row house and to aspire to eventual home ownership. Thomas had immigrated to Baltimore from County Cork, Ireland, in 1885, part of the wave of Irish immigrants who sought better opportunities in America's growing industrial cities. He had arrived with little more than his willingness to work hard and his determination to build a better life for the family he hoped to establish in his new homeland. Margaret Morrison, Thomas's wife, had been born in Baltimore to German immigrant parents who had settled in the city during the 1860s. She was a skilled seamstress who took in piecework from local clothing manufacturers, contributing to the family income while managing the household and caring for their children. Margaret was known in the neighborhood for her kindness and her willingness to help other families during times of illness or financial hardship. The Morrisons had been married in 1888 at St. Patrick's Catholic Church, and their first child, James, had been born in 1889. James was a healthy, active boy who had developed normally and who showed promise of following his father into skilled industrial work when he came of age. When Margaret became pregnant again in 1890, the family was overjoyed at the prospect of giving James a sibling and expanding their small but happy household. The pregnancy proceeded normally, with Margaret receiving care from Dr. Samuel Whitman, a respected physician who served many of the working-class families in the Federal Hill area. Harriet Morrison was born on March 15, 1891, after a normal labor and delivery that lasted approximately 8 hours. She weighed 6 pounds and 4 ounces at birth, which was considered healthy for the time, and she showed no signs of any developmental abnormalities or health problems that might have suggested the tragedy that would unfold in the months to come. Whitman's examination of the newborn revealed a perfectly normal infant with good muscle tone, appropriate reflexes, and no obvious physical defects. Harriet's breathing was strong and regular, her heart rate was normal, and she demonstrated the typical behaviors of a healthy newborn, crying when hungry or uncomfortable, settling when fed or comforted, and showing the primitive reflexes that indicated normal neurological development. The first months of Harriet's life were filled with the normal joys and challenges of caring for a new baby. She fed well, whether nursing from her mother or taking bottles of cow's milk that had been carefully prepared according to the latest medical recommendations. She slept for appropriate periods, cried when she needed attention, and gradually began to show the signs of developing awareness that marked normal infant development. Margaret kept detailed records of Harriet's progress, noting when she first smiled at 6 weeks, when she began to follow objects with her eyes at 2 months, and when she started to reach for toys and other objects at 4 months. These milestones were all within the normal range for infant development, and both parents took pride in their daughter's apparent health and vigor. By 6 months, Harriet was sitting up with support, babbling in the complex syllables that indicated normal language development, and showing the curiosity and engagement with her environment that characterized healthy babies. She had grown steadily since birth, gaining weight and length at the expected rate, and Dr. Whitman pronounced her to be thriving during his regular examinations. The 7th, 8th, and 9th months brought continued normal development. Harriet learned to sit up without support, began to crawl with determination around the family's small parlor, and started to pull herself up to standing position while holding onto furniture. Her vocalizations became more complex and purposeful, and she began to show recognition of familiar words and simple commands. By 10 months, Harriet was cruising along furniture, taking tentative steps while holding onto chairs and tables, and demonstrating the kind of physical courage and determination that suggested she would be walking independently within a few weeks. Her language development was also progressing normally, with clear attempts at words like mama and dada that delighted her parents and older brother. The 11th month of Harriet's life marked the peak of her normal development. She was pulling herself up to standing position with confidence, taking several independent steps before falling and showing all the signs that she would soon be walking freely around the house. Her vocalizations had become more sophisticated, with clear attempts at multiple words and obvious understanding of simple conversations and instructions. Margaret and Thomas were already making plans for Harriet's first birthday celebration, looking forward to the milestone that would mark her transition from baby to toddler. They had purchased a small wooden rocking horse as a birthday gift and had invited family and friends to celebrate what they expected would be the first of many happy birthdays for their daughter. Then, with shocking suddenness, Harriet's development simply stopped. It was not a gradual slowing or a temporary plateau, but rather an abrupt cessation of all growth and development that occurred sometime during her 11th month of life. One day she was a normal, developing baby on the verge of walking and talking. The next day, her progress had frozen, as if someone had pressed a pause button on her biological development. The first sign that something was wrong came when Margaret noticed that Harriet had stopped gaining weight during her regular weekly weigh-ins. For several weeks, the baby's weight remained exactly the same, down to the ounce, which was unusual for an infant who had been growing steadily since birth. More concerning was the fact that Harriet seemed to lose interest in attempting to walk. She continued to pull herself up to standing position, but she no longer tried to take independent steps or to cruise along furniture. It was as if the drive to develop new motor skills had simply vanished, leaving her content to remain at the developmental level she had already achieved. Her language development also plateaued in a way that became increasingly noticeable as weeks passed. While Harriet continued to babble and vocalize, she made no progress toward forming new words or expanding her vocabulary beyond the few simple syllables she had already mastered. Margaret initially attributed these changes to a temporary developmental pause, knowing that children sometimes went through periods of slower growth before resuming their normal progression. However, as weeks turned into months without any sign of resumed development, both parents became increasingly concerned about their daughter's condition. Dr. Whitman's examination of Harriet at her 12-month checkup revealed a child who appeared to be healthy, but who had made no measurable growth in height or weight since her 11-month visit. More puzzling still, her developmental milestones had not only stopped progressing but seemed to have regressed slightly, as if she were losing some of the skills she had previously acquired. The physician was initially reluctant to diagnose any serious problem, knowing that children developed at different rates and that temporary plateaus were not uncommon. However, he recommended more frequent monitoring and suggested that if Harriet's growth did not resume within a few months, she should be evaluated by specialists who might be able to identify any underlying medical conditions. As Harriet's second year of life progressed, it became increasingly clear that something was fundamentally wrong with her development. While her chronological age advanced, her physical and developmental age remained frozen at approximately 11 months. She continued to look, sound, and behave like a baby approaching her first birthday, even as months and then years passed. The psychological impact on the Morrison family was devastating. Margaret, in particular, struggled with the realization that her daughter was not developing normally and that the future she had envisioned for Harriet, school, friendships, marriage, children of her own, might never come to pass. Thomas tried to maintain optimism, believing that medical science would eventually find a cure for whatever condition was affecting his daughter. However, as consultation after consultation failed to provide answers or effective treatment, even his faith in medicine began to waver. James, Harriet's older brother, found himself in the confusing position of having a sister who was chronologically only 2 years younger than him, but who remained a baby while he grew into a school-aged child. The family dynamics became increasingly complex as James struggled to understand why his sister never grew up and why his parents devoted so much time and attention to caring for what appeared to be a perpetual infant. The first specialist consultation came when Harriet was 18 months old and still showed no signs of resumed growth or development. Dr. Whitman referred the family to Dr. Harrison Clark, a pediatrician at Johns Hopkins Hospital who specialized in growth disorders and developmental abnormalities. Johns Hopkins Hospital had been established in 1889 as one of America's premier medical institutions, with a mission to advance medical knowledge through research and to provide the highest quality care to patients regardless of their ability to pay. The hospital's pediatric department was considered among the best in the country, with access to the latest diagnostic techniques and treatment methods. Dr. Clark's examination of Harriet was the most thorough medical evaluation she had ever received. The physician measured every aspect of her physical development, tested her reflexes and motor skills, and conducted a detailed assessment of her cognitive and language abilities. He also took a comprehensive family history to identify any genetic factors that might explain her condition. The results of Dr. Clark's evaluation were both fascinating and deeply troubling. Harriet's physical measurements, height, weight, head circumference, and limb proportions were all consistent with those of an 11-month-old infant. However, her cognitive abilities and awareness were clearly more advanced than would be expected for a baby of that developmental age. Dr. Clark noted that Harriet showed clear recognition of familiar people, responded appropriately to simple commands, and demonstrated problem-solving abilities that suggested normal intellectual development despite her arrested physical growth. She could manipulate toys in sophisticated ways, showed preferences for certain activities and objects, and displayed emotional responses that were more complex than those typically seen in infants. The physician's preliminary diagnosis was that Harriet was suffering from some form of severe growth hormone deficiency, possibly caused by a malfunction of the pituitary gland that regulated growth and development. However, the diagnostic tools available in 1892 were limited, and Dr. Clark could not definitively identify the underlying cause of her condition. Dr. Clark recommended a series of experimental treatments that were being developed for children with growth disorders. These included injections of animal-derived growth hormones, dietary supplements designed to stimulate growth, and physical therapy exercises intended to encourage normal motor development. The hormone treatments were particularly challenging for both Harriet and her family. The injections were painful and had to be administered daily, causing distress for a child who could not understand why she was being subjected to these uncomfortable procedures. The hormones themselves were derived from animal sources and were often contaminated or ineffective, leading to side effects without providing any therapeutic benefit. Despite months of treatment, Harriet showed no response to any of the interventions attempted by Dr. Clark and his colleagues. Her growth remained completely arrested, and her development continued to be frozen at the 11-month level, even as her chronological age advanced toward 2 years. The failure of medical treatment to provide any improvement in Harriet's condition led the Morrison family to seek additional opinions from other specialists. Over the next several years, they consulted with physicians in Philadelphia, New York, and Boston, hoping to find someone who could diagnose and treat their daughter's mysterious condition. Each consultation brought new theories and new treatments, but none provided the breakthrough that the family desperately sought. Harriet was diagnosed with various conditions: pituitary dwarfism, thyroid deficiency, genetic growth disorders, and subjected to an array of experimental treatments that ranged from hormone injections to radiation therapy to surgical interventions. The radiation treatments were particularly traumatic, as they required Harriet to remain motionless for extended periods, while high-energy X-rays were directed at her pituitary gland in an attempt to stimulate hormone production. The treatments were based on the emerging understanding of radiation's effects on biological tissues, but the long-term consequences of exposing a child to such high doses of radiation were not yet understood. Surgical interventions included attempts to stimulate the pituitary gland through direct manipulation and procedures designed to improve hormone circulation throughout her body. These operations were extremely risky for such a small patient, and they provided no lasting benefit while subjecting Harriet to additional pain and trauma. As Harriet's condition entered its 3rd year, the family began to accept that medical science might not be able to provide a cure for their daughter's condition. The focus shifted from seeking dramatic interventions to managing her daily care and attempting to provide her with as normal a life as possible, given her limitations. This transition was particularly difficult for Margaret, who had devoted enormous energy and hope to finding a medical solution for Harriet's condition. The realization that her daughter might remain forever trapped in an infant's body was devastating, and Margaret struggled with depression and anxiety as she contemplated the long-term implications of caring for a child who would never grow up. The practical challenges of caring for Harriet became increasingly complex as the years passed. While her physical needs remained those of an infant, feeding, bathing, changing diapers, constant supervision, her intellectual and emotional needs were those of a growing child who needed stimulation, education, and social interaction. Margaret and Thomas developed creative solutions to address Harriet's unique needs. They created a modified educational program that allowed her to learn to read and write despite her physical limitations, holding books and writing materials for her while she directed their movements with gestures and vocalizations. Harriet's intelligence became increasingly apparent as she grew older chronologically while remaining physically unchanged. She demonstrated remarkable memory abilities, could follow complex instructions, and showed sophisticated understanding of the world around her. However, her ability to communicate remained severely limited by her infant vocal cords and motor control. The family developed a complex system of communication that combined simple words, gestures, and facial expressions to allow Harriet to express her needs and desires. While this system was adequate for basic communication, it was frustrating for both Harriet and her family, as it could not convey the full complexity of her thoughts and emotions. By age 10, Harriet had learned to read at an advanced level, though she required assistance to turn pages and to position books where she could see them. She showed particular interest in stories and poetry, and she seemed to find comfort in the escape that literature provided from the limitations of her physical existence. Her emotional development also continued normally. Despite her arrested physical growth, she experienced the typical emotions and concerns of childhood: curiosity about the world, attachment to family members, frustration with limitations, and joy in small pleasures and achievements. However, Harriet also experienced emotions that were unique to her situation: profound frustration at her inability to communicate effectively, sadness about her isolation from other children, and a growing awareness that she was fundamentally different from everyone around her. The social isolation that resulted from Harriet's condition was perhaps the most heartbreaking aspect of her situation. Other children were initially curious about the baby, who seemed to understand everything they said, but they quickly lost interest when they realized that Harriet could not participate in normal childhood activities. Adults often treated Harriet as if she were actually an infant, speaking to her in baby talk and offering her toys appropriate for much younger children. While some people made efforts to interact with her at an age-appropriate level, many found it difficult to reconcile her infant appearance with her obvious intelligence and awareness. The family's social life was also severely impacted by Harriet's condition. Social gatherings became complicated affairs that required extensive planning to accommodate her needs, and many friends and relatives gradually distanced themselves from the family, either because they were uncomfortable with Harriet's condition or because they simply didn't know how to interact with her. As Harriet entered her teenage years chronologically, new challenges emerged that tested the family's ability to cope with her unique situation. While she remained physically an infant, she began to experience the emotional and psychological changes associated with adolescence, creating a profound disconnect between her mental and physical development. Harriet showed signs of developing romantic feelings and sexual awareness, despite being trapped in a body that could not express or act upon these normal human emotions. This created additional layers of frustration and isolation as she experienced desires and feelings that she could neither communicate nor fulfill. The family struggled to address these aspects of Harriet's development, as there were no guidelines or precedents for helping someone navigate adolescence while remaining physically an infant. They attempted to provide her with age-appropriate information and emotional support, but the fundamental limitations of her condition made it impossible to address all of her needs. Margaret's health began to decline as the stress of caring for Harriet took its toll on her physical and emotional well-being. The constant lifting, feeding, and supervision required to care for a dependent individual, combined with the emotional burden of watching her daughter's ongoing suffering, led to chronic fatigue and depression that affected her ability to function normally. Thomas also struggled with the long-term implications of Harriet's care, particularly as he and Margaret aged and became less able to provide the intensive support she required. The family had no clear plan for what would happen to Harriet if her parents became unable to care for her, as institutional care for someone with her unique needs was virtually non-existent. By 1920, when Harriet was 29 years old chronologically, the full tragedy of her condition had become apparent to everyone who knew her. She had the intellectual capacity and emotional depth of an adult woman, but she remained trapped in the body of an 11-month-old infant, weighing only 16 pounds and standing less than 2 feet tall. Her eyes, which had retained their infant blue color, held an awareness and intelligence that was heartbreaking to witness. Those who took the time to really look at Harriet could see the adult consciousness trapped within the infant form, and many found the experience profoundly disturbing. Harriet had learned to communicate her basic needs through a complex system of gestures and vocalizations that her family had learned to interpret over the years. However, her ability to express complex thoughts and emotions remained severely limited, creating ongoing frustration for someone who clearly had much to say, but no effective way to say it. The medical community continued to study Harriet's case, though more as a scientific curiosity than as a patient who might benefit from treatment. Her condition had been documented in medical journals and presented at conferences, contributing to the growing understanding of growth disorders and pituitary function. However, the focus on her medical significance sometimes overshadowed her humanity, and Harriet was occasionally subjected to examinations and procedures that served research purposes rather than her own well-being. The family had to balance their desire to contribute to medical knowledge with their responsibility to protect Harriet from exploitation. As Harriet entered her 30s, her physical health began to show signs of strain from the long-term effects of her condition. Her immune system, which had never fully matured beyond the infant level, became increasingly vulnerable to infections and illnesses that would be minor for a normal adult. Her respiratory system was particularly fragile, as her infant-sized lungs and airways were inadequate for supporting the metabolic needs of her adult consciousness. She developed frequent respiratory infections that were difficult to treat and that gradually weakened her overall health. The winter of 1922-1923 was particularly harsh in Baltimore, with extended periods of cold weather and frequent snowstorms that kept the family confined to their small row house for weeks at a time. The poor ventilation and coal heating in their home created conditions that were particularly challenging for someone with Harriet's respiratory vulnerabilities. In February 1923, Harriet developed what initially appeared to be a minor cold, with symptoms of congestion and mild fever that would normally resolve within a few days. However, her infant-sized respiratory system was unable to clear the infection effectively, and the cold quickly progressed to pneumonia. Dr. Whitman, who had continued to care for Harriet throughout her life, recognized the seriousness of her condition and recommended hospitalization. However, the hospitals of 1923 were not equipped to care for someone with Harriet's unique needs, and the family decided to care for her at home, where she would be more comfortable. Margaret and Thomas took turns sitting with Harriet around the clock, attempting to keep her comfortable and to help her breathe as her condition worsened. They used steam treatments and other home remedies that had been recommended by Dr. Whitman, but Harriet's tiny lungs were simply unable to fight off the infection. Harriet Morrison died peacefully in her mother's arms on March 10, 1923, just 5 days before what would have been her 32nd birthday. Her death was attributed to pneumonia, complicated by her underlying growth disorder, though the true cause was the cumulative effect of 32 years of living in a body that had never been designed to support adult consciousness. The autopsy, performed by Dr. Clark at Johns Hopkins Hospital, revealed the full extent of the anatomical abnormalities that had trapped Harriet in perpetual infancy. Her pituitary gland was severely underdeveloped and showed no signs of the normal hormone production that would have triggered growth and development beyond the 11-month stage. More remarkably, the autopsy revealed that while Harriet's body had remained frozen in infancy, her brain had continued to develop normally throughout her life. The neural pathways and structures associated with adult consciousness were fully formed, confirming that she had indeed been a fully aware adult trapped in an infant's body. The findings provided crucial insights into the role of the pituitary gland in human development and contributed to the growing understanding of growth hormone deficiency and its effects on human development. Harriet's case became a landmark in pediatric endocrinology and helped establish the foundation for modern treatments of growth disorders. However, the scientific significance of her case could not diminish the human tragedy of her existence. Harriet had lived for 32 years, as perhaps the most extreme example of the disconnect between physical and mental development, experiencing all the intellectual and emotional growth of normal human development while remaining forever trapped in the helpless dependency of infancy. Her gravestone in Baltimore's Greenmount Cemetery bears the inscription chosen by her parents, Harriet Morrison, forever young, 1891-1923. And while intended as a comfort, the words capture the horror of her existence. Forever young, forever helpless, forever imprisoned in a body that could never express the fullness of her humanity. The story of Harriet Morrison reminds us that human development is a complex and fragile process that can be disrupted in ways that create profound suffering. Her case highlights the importance of the pituitary gland in normal growth and development, while also serving as a testament to the resilience of human consciousness and the capacity for love and care in the face of impossible circumstances. Modern medical science has made tremendous advances in understanding and treating growth hormone deficiency, largely based on insights gained from cases like Harriet's. Contemporary patients with similar conditions can benefit from synthetic growth hormones and other treatments that were not available in her time, preventing the kind of extreme developmental arrest that she experienced. However, Harriet's case also raises profound questions about consciousness, identity, and the relationship between mind and body that continue to challenge our understanding of human existence. Her story serves as a reminder that behind every medical condition is a human being whose suffering deserves our compassion and whose experience can teach us important lessons about the nature of humanity itself. The woman who stopped aging at 11 months teaches us about the fundamental importance of physical development in human experience and the profound tragedy that can result when that development is arrested. Her story stands as a testament to the love and dedication of her family, the limitations of medical science, and the enduring mystery of human consciousness trapped in circumstances that seem to defy the natural order of life. In the archives of medical history, Harriet's case remains a landmark study of severe growth hormone deficiency and its effects on human development. Her preserved medical records and autopsy findings continue to provide insights for researchers studying growth disorders, while her personal story serves as a reminder of the human cost of medical conditions and the importance of treating all patients with dignity and compassion. The frozen child, who never grew up, challenges us to consider the relationship between physical and mental development, and to appreciate the complex interplay of biological and psychological factors that shape human experience. Her legacy lives on in the medical knowledge gained from her case and in the continued efforts to understand and treat the conditions that can so profoundly alter the course of human development.